My name is John Marshall. I'm the Frost Professor of Ophthalmology at the Institute of Ophthalmology, University College, and associated with Moorfields Eye Hospital. Well, the key message from tonight's event is that, first of all, that diabetologists and ophthalmologists are speaking to each other, which is really good news. Secondly, that there have been advances in both the field of diabetology in general and systemic, and in ophthalmology. In the diabetologist zone, we're looking at earlier diagnostics, and we're beginning to look at full loop collection of blood sugar levels, which is just terrific. So the control is improving no end. In ophthalmology, we've been through the era of lasers in the early 70s, and we're now into various pharmaceuticals which control neovascularization, anti-VEGF, etc. But we're also beginning to get into the field whereby we are looking at pharmaceuticals to control diabetic edema, which has been a problem because that's the one part of diabetic eye problems that we've not really had an answer to in the past. So, take-home message: progress, collaboration, we're getting there. I guess the biggest problems we're seeing is that there is a perhaps unexplained increase in the number of diabetics of both types, and that's going on and on and on. So there will be a problem for blinding eye disease unless we actually improve the interaction between the early diagnosis and the diabetic clinic and the various eye hospitals and clinics treating the condition. And part of the problem is going to be numbers. A big part of the problem is going to be funding. And some of the novel technologies that we're beginning to see are expensive. We are beginning to see better diagnostic devices. And together with artificial intelligence and newer algorithms, we will see machine diagnosis. So a lot of the work that's currently done by ophthalmologists will be done by optometrists and general practitioners by machines. So I think that's a great future to look forward to. In terms of detection, we've moved slightly from on-face pictures with fundus cameras to OCT, where we're looking at transacts through the system. And with more and more larger data sets, big data, and the development of AI techniques for segmenting that data, then that's great because we're going to see much more rapid diagnosis and objective monitoring of change. Then, of course, we have to treat the patients. So hopefully our diabetologist colleagues will reduce the numbers that we will actually be treating. But if we are treating, we're already beginning to see automated laser treatments whereby the laser is set up to deliver impacts but exclude the macular region, so we're not actually going to rob any patients of damage. So it's a further automation. And we will see newer and newer pharmaceuticals addressing the issues of vascular development and fluid movement in the retina.